Senator Franken.
I'll tell you how we get a really big risk pool. It'd be called Medicare for everyone. That would be the biggest risk pool. Dr. Price, it was nice meeting you the other day.
Yeah, it was good.
Did you enjoy meeting me?
Thank you. I did. I did. I enjoyed our discussion about our gray hair.
Yeah. Dr. Price, what is the leading cause of preventable death in the United States?
I'll defer to you. You've obviously got it on the page in front of you.
I actually knew this before I put it on the page. It's smoking.
Well, that hits home. I lost my dad, who was a Lucky Strike smoker from World War II to emphysema, and he prided himself on the fact that he never smoked a cigarette with a filter for years and years, and it was incredible tragedy.
I lost my dad too.
Yeah.
As a physician, you may know, I guess you didn't, that smoking kills approximately 480,000 Americans each year and totals $170 billion each year in healthcare costs. And yet, between 1993 and 2012, you were a shareholder of tobacco, of big tobacco companies, meaning that you personally benefited from tobacco sales. Meanwhile, you voted against landmark legislation in 2009 that gave the FDA the authority to regulate tobacco. Congressman Price, you're a physician, which means you took the Hippocratic Oath, a pledge to do no harm. How do you square reaping personal financial gain from the sales of an addictive product that kills millions of Americans every decade with also voting against measures to reduce the death toll inflicted by tobacco?
Well, it's an interesting question, Senator, and it's a curious observation. I have no idea what stocks I held in the 90s or the 2000s or even now. All of these decisions for all of us, I suspect, are through mutual funds and through pension plans. I would bet, and I don't want, well, I ought not bet here. I would suspect that in your pension plan, that there are components of that that are held that may have something to do in some time in your history with tobacco. So
I find it very hard to believe that you did not know that you had tobacco stocks. I find it a little hard to believe that in the questions about your stock portfolio, you've said you didn't know things. Just over the last 4 years, you traded more than $300,000 in health-related stocks, while at the same time sponsoring and advocating legislation that could affect the performance of those stocks. Now, we've talked a little bit about the Zimmer Biomet. Your broker, you say, you didn't know this, bought it on March 17, 2016. You did introduce a bill later, a week later, on March 23rd, 2016. You say that you did not know then that you had this stock. It was a rule it was to delay a federal rule that would have reduced the profitability of the company's joint, to delay a rule that would hurt the company. What I don't understand is once you found out that your broker bought it, you kept the stock. You purchased this $50,000 to $100,000 worth of stock in a biomedical company called Innate Immuno. We've talked about it a little bit. It's the single largest purchase in the past 3 years in a private deal that was not made available to the public. And I find it absolutely amazing that you responded that you did not know that you got a discounted price. That is absolutely amazing because we discussed this.
Well, by definition, I believe that's the nature of a private placement offering. What I said to you and what I've said to others is that I paid exactly the same price as everybody else. I disclosed
it. It was a private offering that only went to about 20 people, including Representative, your colleague, Chris Collins, his chief of staff, and a prominent D.C. lobbyist. and you reported $50,000 to $100,000 in profits on this purchase. It really begs credulity, sir, when you say you did not know that you got a discount on this. This was a private offering to a very small number. When you have the committee, chairman of the budget committee, when you have a congressman as chief of staff, these sound like sweetheart deals, and I think that our job in this body and in Congress and in government is to avoid the appearance of conflict. And boy, you have not done this. I want to talk just about your latest plan, Empowering Patients First Act. Some of it is detailed in this article from the New England Journal of Medicine. It's called Care for the Vulnerable versus Cash for the Powerful, Trump's Pick for HHS. I'll just read a random paragraph. Price's record demonstrates less concern for the sick, the poor, and the health of the public, and much greater concern for the economic well-being of their physician caregivers. And I would commend this to every member of this committee before making a vote, because what your plan does is, one of the things, it gives a tax credit to Americans to buy health insurance. It's no different for someone who's poor or someone who makes $20,000, $30,000, and to Bill Gates. It is an incredibly regressive system. You have talked about ending you guys want to end the expansion of Medicaid. That has people in Minnesota scared out of their mind. Look, I've heard a lot, Obamacare has been a disaster. First of all, you have to admit that it's bent the cost curve, that the cost of health care in this country has grown less than it did in the previous 10 years. It's also covered 20 million more people, but forget them. In 2008, I would go around the state of Minnesota, in every VFW hall, in every cafe, I would see a bulletin board where it would have a burger bash or a spaghetti dinner for someone who had gone bankrupt because they had gone through their annual cap or their lifetime cap. I am very frightened about what you are going to do, and so are millions of Americans. And frankly, I know that you do things that help that physician groups. You've put in provisions that would prevent these findings by efficiency and innovation boards that would have to be cleared by physician groups. I see you as someone who is there for the doctor, and that this is a cover for, this is not going to create access for all Americans, what you talked about, the Empowering Patients First Act. This is going to unravel something that has given a lot of Americans peace of mind, knowing that their kids can stay on their health care till they're 26, knowing that they have, if they have a pre-existing condition, that won't stop them from getting care. That's what this hearing should be about. And you're a smart man.
Senator, we're a minute over.
Okay, and my second round, I will be a minute short.
Sure.
Okay, thanks.
You may be here by yourself.
I'll be here with him.
You know, the
Thank you,
Benghazi
Senator
hearings
Franken.
was 11 hours. That's all I'm saying.